when you talk about medical tourism out of the United States, you have all of the problems I just listed, and then even more.
Plus your safety, apparently.
Well, apparently, plus the risk of getting kidnapped and
Yeah.
killed by the cartel, which is not a laughing matter, but it's just mind-boggling to think that you even have to worry about that.
No.
But the first thing that you might consider is language barriers. You know, medical language, when I'm talking to a patient, has to be explained very clearly in order for them to properly understand what's going to happen to them. And it can be difficult, and I can tell you from firsthand, because I do speak fluent Spanish, and so when I have patients who are Spanish speaking, I do their consults in Spanish, and I have to be very careful that they're understanding me properly, because my Spanish is very good. I consider myself fluent, but I just want to make sure they understand. And if you, as someone who doesn't speak Spanish, go to a country, or you go to a country where Spanish is spoken, you don't speak it, and their interpreter may not be, you know, perfect with medical lingo, you can end up getting some miscommunication.
Yeah.
You know, so there's that risk. And then the biggest thing about going out of the country is just the unknown about the certification of the physician and the facility. You know, I know I've told you that here, even in Dallas, Texas, we have OBGYNs doing breast augmentations, we have internal medicine doctors doing Brazilian butt lifts. I mean, for that kind of stuff to be happening here in the United States, here in Dallas, which I feel like is a place that is well known for plastic surgery, is kind of unbelievable, but it is.
I feel like it's almost the way it's portrayed is almost like the Wild West, like back when like dentists used to be surgeons,
Right.
Like back like in the like Wild West days.
Totally, and that's
like,
yeah, I think that's how it is in some of these, you know, countries like
they
Mexico.
just do everything.
I mean,
like, I'm your veterinarian, I'm your dentist.
It
I'm
could
your
be.
Doctor,
I mean,
I'm your.
It absolutely could
Yeah.
be that, because the regulation here in the United States is as strict as it is anywhere in the world, and I feel like it's still inadequate. So what are you getting in a foreign country? And
Yeah, you just don't know.
you just have no idea. And it's sad, because people will see web pages that show these, you know, great facilities, and you know, people can make up any credentials they want. Who's to regulate whether or not it's
For sure.
true or not? And I think people are getting, you know, tricked into thinking that this is a safe thing when it's not. You know, I see on average probably one patient per month that has serious complications from medical tourism, and that's covering 3 hospitals. You know, but I mean, how many
Yikes.
people? How many people across the country, just like myself, are seeing those patients? How many of my colleagues in my area that are, you know, on call different days are seeing them? And when you think about it and extrapolate that out into the country, I mean, I think it's a huge problem, and I'm not sure that people know how big that this is. So.
Yeah, I wonder like all the other surgeries besides plastic surgery that people go to.
So I think it's less because most people are seeking out surgeries that are not insurance based.
Okay.
So they're seeking out surgeries they have to pay for out of pocket.
Okay.
You know, for the most
There's a
part.
big handful of people that don't have insurance anymore.
True. Yeah. Yeah, I mean, that is true. I have heard of people going across the border for non-cosmetic stuff. That does happen. Like dentistry stuff is popular. But the same rules apply. I mean, you just have to be very, very careful. And this is not to say that there aren't great doctors, you know, businesses in places like
Yeah.
that. So of course there are. But, you know, I worry about the regulation here in the United States, where it's as strict as anywhere in the world. You know, you just don't know what you're getting when you go abroad. And so,
Yeah.
you know, it's not worth your life to save money. And if you have a complication, you'll end up paying exponentially more than you would if you would have had the surgery here. So
That's for real.
yeah, so if you got friends thinking about medical tourism, please tag them in this, or let them know to come and take a look at it. I don't have anything to gain out of, you know, people not going out of the country. I mean, I'm busy in my practice, and, you know, this is a more national show, not where I practice. I mean, it's purely a patient safety issue. I see people get hurt by it all the time, and I think it's wrong.
It is, for sure.
All right.